Dzień dobry, witam wszystkich Państwa bardzo serdecznie. Dziś w Medexpressie będziemy rozmawiać na temat doświadczenia w leczeniu pacjentów z SMA, a jak wiadomo w terapii rdzeniowego zaniku mięśni pojawiły się nowoczesne leki, które pozwalają na osiągnięcie sukcesu terapeutycznego. A Państwa i moim gościem jest dr Agata Katia Patanella, neurolog z Centro Clinico Nemo Adulti. Hello Katia, it's nice to have you here.
Hello, nice to meet you.
I would like to ask you about your experiences in SMA treatment, but first of all, what is the current availability of SMA therapy in Italy?
Okay, nowadays in Italy, we can prescribe for adult patients type 2 and type 3 SMA, but also type 1 SMA survived with tracheostomy, nusinersen, brand name Spinraza, and risdiplam, brand name Evorisdi. We don't have restrictions regarding age or degree of disability. We can't use, obviously, risdiplam and nusinersen together. And Zolgensma, the gene therapy, is indicated for children for type 1 SMA and up to 13.5 kilograms of weight.
Okay, I'm sure you have a great experience in your job, so tell us please more about it and about your experience in treating patients with SMA and what kind of patients you treat.
So I'm an adult neurologist and I'm involved in the adult treatment of, So I treated my first patients with nusinersen on 2018, and so far I've treated 52 patients with nusinersen, and 44 of them are still on treatment. I treated my first patient with risdiplam 1.5 years ago under a compassionate use program, and so far I've treated 10 patients with risdiplam. 8 of them are still on treatment. So my patients are an heterogeneous group in terms of age, motor disability, swallowing and respiratory involvement, and disease duration. They are SMA type 2 and SMA type 3. And according to new classification, they are sitters, non-sitters, and walkers. They have 30% of them have a severe scoliosis. And one patient have tracheostomy and gastrostomy. So this is my population, my SMA population today.
Mm-hmm. I know that you have also patients with complex spine deformations. I was wondering, how do you manage drug administration in that case, supporting medical techniques? Maybe you could describe us a selected case in that field.
Yes, of course. I've approached this complex spine by using ultrasound. I will explain you better. To identify the entry point of the needle and to perform the intrathecal administration, we use the ultrasound assistance rather than computed tomography or fluoroscopic guidance. So I want to show you a 3D printing spine model of an our patient treated with nusinersen. So in this way, you can see what kind of patient we can treat thanks to ultrasound. So I show you, this is the 3D printing model. And so you can see a very, very high degree of scoliosis and rotation of the spine. So this is only an example, obviously. And last year, we published a work on muscle and nerve. And in this work, we described our experience on 18 patients with complex spines. And we demonstrated a higher success rate, a low attempt number, a high satisfaction patient, and a very short procedure time. So I believe that ultrasound may be a valid choice for this kind of patients, and it may be considered as the first approach. Why? Because first of all, it's a really available equipment in hospital. You can avoid repeated exposure to radiation. As you know, nusinersen is a running therapy, so this is an important issue for us. And then we can treat patients with a very, very severe scoliosis. So I believe in ultrasound assisted procedure.
Now I would like to ask you about specific treatment. I mean, in what cases do you decide to change therapy for your patients, switching from one drug to another one? And how does a patient experience such a change, and what are the benefits of such decisions? And also, is it easy process to make this kind of switch in Italy?
So, my first therapeutic option in adults is nusinersen because we have a real world data, because it's administered where it's needed, and it has a convenient frequency of administration, and no fertility issues were described in animal studies, but also in real world studies. And but sometimes I can administer it. So the main reason to switch nusinersen is the difficulty with intrathecal administration. Another reason may be patient's decision due to poor tolerability of repeated puncture lumbar, and the main reason is difficulty with intrathecal administration. So the process, the switching process in Italy, it's not difficult because I have to, for example, I have to fill out an end treatment form in the IFA platform. IFA is like FDA in America. And then I have to complete a new request drug. It's a little bit more complex, the switching back. I mean, nusinersen, risdiplam, nusinersen, because I have to justify the change to authorities, and it can take time to update the register.
What
in
is
Italy?
Yes,
okay.
yes.
We can switch from oral and intrathecal treatment for SMA type 2 and SMA type 3 patients. SMA type 1 can't switch from risdiplam to nusinersen, but they can switch from nusinersen to risdiplam, and in SMA type 1 patients treated with Zolgensma can't switch to risdiplam or nusinersen.
Also, I would like to ask you about your individual clinical experience compares to real-world evidence, Italian meta-analysis, and Sunfish 2 data.
Okay. My clinical experience is in agreement with the data summarized in the Italian meta-analysis. So I can observe in my population stabilization or improvement on motor function, and I can observe a good tolerability and safety. Regarding to the Sunfish 2 data, as you know, the efficacy of the drug in the adult patients is not demonstrated. So my population is too small to be able to draw conclusion. I followed only 5 patients for 1 year, and these patients are have a very high degree of disability, and in my opinion, the outcome measures is not adequate. So I think that more needs to be done in order to establish the efficacy of nusinersen in adults.
Thank you very much for this interview, for this conversation. Państwa i moim gościem była dr Agata Katia Patanella, neurolog z Centro Clinico Nemo Adulti. Thank you very much.
You're welcome.